The Self-Care Learning and Discovery series is back, and it's bigger and bolder than ever. This is the premier self-care event of the year, bringing together self-care enthusiasts of all backgrounds and disciplines from around the world. The World Health Organization defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. We also know that self-care means different things to different people. What does self-care mean to you? You'll have ample opportunity to reflect on this question during the Discovery series, with more than 20 interactive virtual sessions organized by self-care experts worldwide. The Discovery series will elevate cutting-edge research, programming, and advocacy insights across a wide variety of self-care topics, and we encourage you to attend as many sessions as possible, especially on topics that may be new to you. The Self-Care Learning and Discovery series, a core activity of the Self-Care Trailblazer Group, is organized by the White Ribbon Alliance in partnership with co-sponsor organizations and esteemed steering committee members. We also want to thank all our session organizers and presenters who have voluntarily dedicated their time to curate this event with us. We are pleased to share that every session will offer live, simultaneous interpretation in French, Spanish, and English. To access the interpretation, simply navigate to your meeting controls located at the bottom of your screen. Click on the globe icon labeled Interpretation and select the language you'd like to hear. Joining from your phone, tap on the ellipses to find the interpretation feature and then select your language. Please note, you can switch languages at any time throughout the presentation. The session is now about to begin. Don't forget, whether you're working to influence policies or programs, advance universal health coverage, or improve your own self-care, we hope that you will take the learnings from today's discussion and apply it to your own work. To that end, we invite you to continue the conversation and take action with us by becoming a member of the Self-Care Trailblazer Group. So get curious, jump in, and share your ideas and insights with us. We look forward to advancing self-care together.
All right. Hello, everyone. Welcome to today's session, From Resolution to Revolution, Country Insights on Building an Enabling Policy Environment for Self-Care. My name is Kimberly Whipke, and I'm a Senior Advocacy and Communications Manager with the White Ribbon Alliance. And I also serve as the co-lead for the Self-Care Trailblazer Group, Country Advocacy Working Group. I'm thrilled to be your moderator for today's session. So before we dive in, I did want to provide a few housekeeping notes. So first, if you haven't already, please introduce yourself in the chat box. Put your name, you can put your organization or affiliation and where you're participating from. We really want to get to know you. Second, as mentioned in the video, if you're just joining now, we do have live simultaneous interpretation for this meeting in English, French, and Spanish. So at the bottom of your screen, please go ahead and click that interpretations globe, the little icon, and then select your preferred language, whether it's English, French, or Spanish. And then thirdly, we do ask that you remain muted throughout this meeting unless you're called upon or invited to come off mute and share your thoughts. We really appreciate your cooperation there. All right, next slide, Leanne. Perfect, thank you. So this event is called From Resolution to Revolution because it's really incredible to see how many countries have moved from, resolving to advance self-care to really tangibly creating the enabling environment that's needed to bring sustained self-care practice to reality. And today we have the privilege of hearing from 6 leading advocates who have been at the forefront of accelerating self-care policies in their countries. And each of them will share unique insights and lessons learned from their context that can be potentially taken up, adapted, and replicated in your context as well. So first, as you'll see on the agenda here, we'll hear from 3 countries in East and West Africa that have focused on piloting, scaling, adopting national guidelines, including in humanitarian settings. And then we'll pause for some brief Q&A for those first 3 presenters, and then we'll move on to a second set of presentations that focus on engaging multi-stakeholders, and then also being able to leverage self-care interventions like self-injection to really accelerate wider self-care advocacy efforts in their countries. We'll finish up with another Q&A there. And we do ask that you please put your questions for presenters in the chat box. We'll take those as they come up. Okay, so just before we dive in, just to make sure we're all here and present and excited, if you are excited and energized about today's session, would love it if you could go to your Zoom toolbar and make an emoji of your choice. It could be a thumbs up, it could be a party face, it could be a heart, any type of emoji that speaks to how you're feeling about this session. Perfect. I'm seeing some party poppers. What else am I seeing? Hearts. Excellent. Ooh, I love the sunglasses. All right. We've got a really passionate, ooh, and even a kiss. I love it. All right. Thank you so much. We've got a great session for you today. So without further ado, I'm going to introduce our first presenter. So Pamela Adhiambo is the Advocacy and Communications Officer at Reproductive Health Network, Kenya, where she leverages her expertise in sexual and reproductive health and rights, environmentalism, and the arts to make a positive impact in the lives of young people, women, and men facing SRH challenges in her community and beyond. She leads the National Self-Care Network project implementation in Kenya. So Pamela, it's a pleasure to have you. Next slide, Leanne, over to you.
Thank you so much, Kim. I hope I'm audible enough and you can be able to see my face. Okay. Well, my name is Pamela, as Kim has said, and I'll be representing Reproductive Health Network Kenya today. And my abstract is on Kenya's country experience adapting and adopting national self-care guidelines. So we quickly go to the next slide, please. So a little bit of background, which I feel like is similar in different contexts. We see that statistics say that half of the world's population lack access to essential health services. And when we look at essential health services, it's basic health services. So when we come to look at reproductive health, then if we are not able to access even the basic of health services, then reproductive health becomes even a bigger problem. And we look at our Kenyan context as the statistics say that 14% of women of reproductive age have an unmet need for family planning. And we even look down to see that 43% of the pregnancies are unplanned. And this is just a little bit of I'm just highlighting a little bit of some of the issues, but the issues run deep beyond family planning. It goes into safe abortion access, it goes into other reproductive health issues, maternal health, and so on. So we really see that this is a challenge. Accessing some of these reproductive health services is a challenge, and it could be issues of cost, issues of proximity to healthcare facilities, issues of affordability, issues of stigma, especially for young people and even marginalized groups. And then we come and see self-care here as defined by WHO as the, I know everyone by now should probably know the definition of self-care. So it looks at placing the individual at the center of their own health to address some of these challenges. And we see self-care as an intervention that has the potential to remove some of these barriers in accessing sexual reproductive health in our country context, and even information, especially for our young people. Access to information on SRH has been a challenge here in Kenya. And even when we looked at marginalized groups, For instance, the LGBTQ community, most of the times they face stigma when they go to access some of these services, which becomes a really huge challenge. Some of the people who live in humanitarian settings are not able to access these services because of probably their situation. It could be drought, it could be floods and war. And so it becomes, self-care becomes a really ideal intervention. And we look at the WHO self-care guideline looking to address some of these SRH challenges, and it is looking to place the individual at the center of their own health so that the solutions or how you address these issues comes from the individual and they're able to initiate it by themselves. And we see by adopting these guidelines here in Kenya, we felt like it would be very important in addressing some of the SRH-related issues so that we can fast-track the achievement of primary health care and universal health coverage. Next slide, please. To how Kenya was able to do this. So when we started out last year, just to mention that Reproductive Health Network Kenya is the national self-care network lead here in Kenya under the Self-Care Trailblazer Group. And our mandate was to make sure that self-care is institutionalized into policy and integrated into the health system. And we cannot say that we did this alone. As you have heard, it's a network. So we were able to do this through a collaborative approach. So the main thing we did was awareness creation and advocacy. We really did a lot of awareness creation and advocacy. And before we did that, we just did stakeholder mapping to just see who are some of the partners who are working on self-care here in Kenya that we can partner with to just have a force that can be able to advocate for self-care and also support in creating awareness in different areas they are working in. And then we also did a legal and policy analysis of just look at the legal framework that speak to self-care, to just look at our country context, what laws speak to self-care, which ones are an opportunity that we can be able to advocate for the inclusion of self-care, or if there is none, which we found there was no legal framework that specifically spoke to self-care, so that we can advocate for one to be in place. And from our advocacy efforts, from our awareness creations, we got the attention of the Ministry of Health, lucky enough, and they were able to initiate the domestication of these self-care, the WHO self-care guidelines. So the Ministry of Health was able to have 4 different phases that we worked with them as a coalition that was working to make sure that we have self-care into our policy. So the first phase we had was an ideation phase where we just sat with the Ministry of Health as partners to just look at what is the state of the country, what on self-care is happening, to what extent do we want our community to practice self-care, to what extent do we want our healthcare providers to extend their support, where do CHVs come in? It was basically to look at an overview of how we wanted self-care to happen in Kenya. And we also looked at the WHO self-care guidelines. I know it covers a wide range of SRHR issues, but we had to look at it to just contextualize what are some of the issues that we feel were important for Kenya at that particular moment. After the ideation phase, we now went into the drafting phase, where we just drafted guidelines to just make sure we have a comprehensive guide of how we want to do our self-care work. And then we did a finalization to just have the final touches, making sure that we have not missed on anything. And then we did a validation meeting where we just validated the whole thing to make sure that where we had different partners validate, to make sure that everything that we wanted covered was covered at that particular time. And as I had mentioned earlier, this was more of a collaborative approach. So our Ministry of Health was very keen on working with different partners to ensure that when we are developing the guideline, it is as comprehensive as possible and as inclusive as possible. So we had different partners from the pharmacies, the CSOs, the doctors, nurses. In Kenya, we have counties, so even representation from different counties, that is similar to districts or provinces, depending on where you're coming from. So we had representations from even different health departments in the Ministry of Health itself, including the the non-communicable diseases and things like that. Next slide, please.
2-minute warning, Pamela.
Okay, so we finally got to have a national guideline for self-care and reproductive health from all these advocacy that we did that guided how different actors and healthcare providers provided support for healthcare patients. And we focused on these priority areas: the maternal and neonatal health, family planning, infertility, and some of the cross-cutting issues that are within reproductive health. That is HIV, that is things like STIs, cancers, and the likes. And we looked at all those different areas of focus in terms of self-awareness, what the clients needed to know, what they needed to self-test, and how they could manage their health. And it was also progressive to see that we were able to also bring in innovations like telemedicine that can support in clients initiating self-care, seeking help, and even referrals when doing self-care. And we are currently working on a self-care training manual for providers, because here in Kenya, we believe that self-care should be initiated from the healthcare provider so that they are able to assess the eligibility of a client to practice self-care on themselves. Next slide, please. So in conclusion, we see that integrating self-care into our health system has a critical thing in achieving primary healthcare and universal health coverage. And when we look at primary healthcare, we look at having education on some of these things: prevention of diseases, having access to family planning, having access to some of the commodities which speak to what self-care is going to solve in our country context. And we just look to see that we can optimize this to have safe, affordable, effective, and quality care for individuals. And it is going to address some of the health issues that we have been facing over time. Next slide, please. So our recommendations are, we feel like it is very important to always support some of these global policies that come in and just adopt them to our country context, especially in terms of self-care, like we did with the WHO guidelines, so that it complements what our health system is already doing. It is also important to train our healthcare providers and community health promoters. That is how we call them in Kenya. You can call them CHVs. Yeah, so we train them also on self-care so that they can be able to be agents who support self-care practicing clients. And to also create awareness about self-care to the community, to make sure that they are aware of this intervention, and to make sure that we disseminate these guidelines to even the provinces or the counties where we different people are, disseminate them to the grassroots so that everyone should be able to know of these guidelines. And finally, we have to make sure we also advocate for budgetary allocation for this intervention, to make sure that even I saw something that came up, I think this week, who pays for self-care? So we need to look at these things, see at the cost, see who is going to take charge of what, and see that the government is able to also include this in their allocation so that we can be able to practice this effectively. Yeah, and thank you. I think that is the end of my presentation.
Perfect.
Thank you so much.
Thank you, Pamela. You set a good bar for the rest of our speakers in terms of sticking to time. And thank you for ending on that call to action around mobilizing funds to move this work forward. Thank you, Pamela. If you have questions for Pamela, please put them in the chat box. We'll have a Q&A in just about 20 minutes or so. Next slide, please. We're going to move on to our next speaker because we're hearing from so many diverse and varied experts today. So our next speaker is Dr. Moses Mwangi. He is a Uganda-trained medical doctor with experience in sexual and reproductive health programming, especially advocacy and accountability. He is currently a senior advisor at the Samasha Medical Foundation and was the Uganda National Self-Care Consultant. He facilitated the development of the Uganda Self-Care Guideline and its piloting in Mukono District. So Moses, you're most welcome.
Thank you so much. Thank you so much. And thanks for organizing this important meeting. Just to reiterate, I'm presenting this because I was the national self-care consultant who facilitated the process of adoption of the WHO guidelines for Uganda. Next slide, please. When the WHO produced the first guideline in 2019, countries Uganda and Nigeria moved forward to really adopt the guidelines. And just to reiterate that this guideline, the self-care guideline, looks at moving away from the provider-centered care system to a people-centered healthcare system, but also evidence-based, so that the self-care interventions that are being carried out are really evidence-based rather than speculation. So with the call to adopt the WHO self-care guideline of 2019, Uganda took up the process and developed the guideline. You can see on the right side. Next slide, please. But during the process of development of the Uganda guidelines, Uganda chose to really look at sandboxing approach, where the guidelines are developed and tested. Now, the typical approach that we always do in policy implementation is to develop the guidelines or a policy without testing, but you go through stakeholder validation. And once the stakeholders say, yes, go ahead and start implementing, then you go ahead and start implementing. And in that way, there's usually less understanding of how health systems will react to the guideline that you are developing or the policy. So what Uganda did was to go the sandboxing approach, where you develop the guidelines, you develop the capacity strengthening materials, and then focus also on raising community and individual awareness about the guidelines and what the interventions the guidelines talks about. Also apply the social behavior change principles at a community level. And really, with the sandboxing, you must be very careful at choosing the local setting where you're going to implement the guidelines. So the approach we took for Uganda really provides us some lessons. Next slide, please. It provides some lessons that I'll share later. But in summary, the roadmap for Uganda was that we had the phase one, where really government took ownership of the process and significantly got a focal person, Dr. Charles Oraro, who is at the director level, who would be chairing all the meetings and really providing the stewardship and guidance on developing of the guidelines. Then phase two of the process was basically establishing the self-care expert group, which was chaired by a director from the Ministry of Health and assisted by an assistant commissioner of adolescent and school health. Now, this self-care expert group is the one that actually participated in the process of recruiting the national self-care consultant, making sure that all the processes are going according to plan, but also it played a big role in the sandboxing approach. Then phase two was basically carrying out a situation analysis and developing of the draft guideline. And once the guideline was developed, then went into sandboxing, that is implementation of the guidelines in a learning district. And I want to emphasize here that the learning district had to have certain qualities. One of them, it was metropolitan, it had a hard-to-reach area, but also it was rural. So it had three components that we felt were necessary ingredient, but also it had previous history of self-care interventions within the district. And then once we did sandboxing, then we went ahead and incorporated the learnings from phase 4 and finalized the guidelines. Next slide, please. But what did we learn from the sandboxing? The results of the sandboxing really informed the policy development and guideline improvement. One of them is that, for instance, one of the interventions we had thought of was really using a standard urine dipstick test for individuals. But when we went to the district and started piloting, we realized that the dipstick was going to be very complicated. It had a lot of colors and people would not really interpret them well at their level. So it helped us to remove the urine dipstick test from the guideline. And then also initially we had thought of using the HIV tests offered, but we realized that first of all, Determine was one of the algorithms in Uganda. It was, the first test, but also it was unsuitable for self-care because of the buffers. And so we replaced them with the OraQuicks, Insti, and SureCheck. But if we had not done this, then maybe we would now be struggling with that Determine at self-care level. Then the other intervention that we had thought of, which was in the guideline, was really malaria test kits, the rapid malaria diagnostic kits. Now, when we were doing that, we never realized the operational challenges that an individual would have while doing a rapid diagnostic test for malaria. We realized that within the healthcare system, the rapid test kit, they give you each individual a test, but they share a buffer. So the way the test kit is packaged, it's packaged in a way that provides 25 tests and 1 buffer. So it was impossible to practice self-care using this rapid diagnostic test for malaria. And so I had to remove it, but that was out of the experience. Next slide, please. But also this sandboxing generated really valuable feedback as regards to understanding how to scale up self-care. For instance, we realized initially we were thinking that we are going to use the same training materials for village health teams, health facilities going up. But upon implementation in the e-learning district, we realized that the community health teams needed lighter materials, more visual, so we changed the training materials. Then also social behavior change communication is very important to create self-awareness within the self-care arena. But while we were doing the sandboxing, we realized a very expensive endeavor. So within the new now guidance, we really plan and budget from the beginning to community awareness and demand creation. So it has helped us to be able to foresee challenges that we would have faced if we had just gone direct to implementing the guideline without sandboxing it. Then also private health facilities. During the implementation of the guideline, we went to the private health facilities, the government facilities, and faith-based facilities. Now, we realized that there was concern from the private facilities about the reduction in profits, which was not actually real, but was assumed. And then we had to engage the professional bodies to explain that self-care is not coming to take away private business, but it's coming to support the private business. And we had to produce some data based on the implementation data. Next slide, please.
This is your 2-minute warning. Thanks.
Yeah. So what really sandboxing helps us to do is really to make sure that the country implements the policy that they've tested. So this innovative policy testing and adoption could be applied in other countries. And we're already developing under Propel the how to guide so that other countries can use the how to guide to really adapt the similar process in developing their guidelines. Next slide, please. So thank you so much. And we'd like to thank Propel Health for the support. Over to you.
Thank you so much, Moses. You were right on time. So fascinating. I just put in the chat that I was really struck by some of the very, very practical learnings that you experienced from actually going through the motions of testing these packages of interventions and seeing what works and what the bottlenecks are. So with that, we will move on to our next featured presenter. Tahira Omolara Eniola is a passionate advocate for social change. As the Research and Innovation Manager at the International Rescue Committee Nigeria, Omolara has committed her professional journey to confronting challenges related to poverty, education, and sexual and reproductive health. She has spearheaded transformative initiatives that have not only uplifted marginalized communities, but also emboldened them to take control of their lives. So Omolara, over to you.
Thank you so much, Kim, for the warm welcome. And I'll be sharing insights from Nigeria's collaboration together with the Humanitarian and Development Nexus. Just as Dr. Moses mentioned from Uganda, Nigeria has gone, and Uganda are one of the 2 countries that have really made significant stride in adopting the WHO national guideline. And so most of the processes that he described, Nigeria has gone past all of those phases. And we're currently right now at the phase of domesticating the national guidelines at state level. Next slide, please. And so I would like to start by providing a brief background about the geographies where IRC works. Yeah, thank you. In Nigeria. So our operations are domiciled in crisis-affected Northeast and Northwest Nigeria. However, our self-care work is currently being implemented in Northeast Nigeria, where as of February 2023, there are over 2 million internal displaced persons. Most of these people face increased barriers to accessing facility-based healthcare due to insecurity, poor health coverage, inadequate human resource for health, supply chain, and other barriers. For us, we know that this can result in devastating consequences, with about 64% of maternal deaths occurring in fragile settings alone. And 30% of these deaths could be prevented through access to contraception. And so at the IRC, we believe that self-care is a promising solution that can help meet this gap and bring life-saving services closer to crisis-affected populations. Yet, self-care investments are not being made in the fragile context of our country that needs it the most. Next slide, please. And so IRC recently commissioned a global assessment to identify barriers and opportunities for self-care programs, research, and advocacy in humanitarian and fragile settings, where we learned that donors, policymakers, and others, they want to see evidence, that demonstrates the feasibility to implement self-care in fragile settings. They also want to see some kind of bottom-up community-informed approaches to self-care based on engagement with women, girls, and other communities. We've also heard from donors and implementers that it is important for them to see self-care as part of resilience building, part of emergency preparedness, and as part of health system strengthening. In Nigeria, we have guidelines. However, we know that guidelines they are necessary and important, but they are not sufficient because program implementers need tools and resources to operationalize these guidelines in fragile settings specifically. As you will all agree that an enabling policy environments are critical to driving evidence, operationalizing guidelines, and facilitating scale-up of self-care interventions in all settings, not just in the humanitarian settings. And on the next slide, you'll see what the IRC is doing in Nigeria to address these gaps. Thank you. So we are working to scale and deliver SRHR self-care in crisis-affected context of Nigeria. We're doing this through a marriage of research and advocacy. So we're generating evidence through our research and innovation, and we're instituting an enabling environment through state-level advocacy. So currently, we're implementing a mixed method research study that is focused on self-managed contraception. We want to identify existing practices and interventions to also assess the readiness of health facilities and pharmacy drugstores to provide self-care services. We want to identify entry points for introducing and scaling up self-care interventions. And as part of our innovation, we plan to design and test solutions to leverage entry points and address some of these key barriers. And finally, we hope to develop tools and approaches that would support implementers to operationalize guidelines in fragile settings. Next slide, please. Yep. And so IRC, at the IRC, we have our key advocacy message to advance self-care in humanitarian fragile settings. And what we're saying is that SRH self-care can help improve resilience to health shocks. It can extend health coverage and improve health equity. For us, we're approaching self-care from a life course lens while continuing to advance self-managed contraception, including ensuring linkages to community-based maternal and newborn health. It is interesting to note that this is also an advocacy strategy that is desired by the local governments where we work. Next slide, please. So there's a broad misperception that self-care programming in humanitarian and fragile settings is significantly different than it is in stable settings. However, this misperception is not true. We've seen that they share a lot in common than originally assumed. And so, for example, in Nigeria, most of the current self-care interventions are majorly domiciled in stable settings in places like Lagos, Abuja, and Niger. So what we have in Nigeria is states and local governments, very similar to provinces and districts. And so we also saw that there's limited inclusion of humanitarian and fragile context considerations within national and sub-national policies. As part of our engagement, we discovered that the national advocacy community in stable settings they were unfamiliar with some of the humanitarian consideration. And so together with White Ribbon Alliance Nigeria, the Federal Ministry of Health, and other partners, we hosted a workshop in July this year that brought together stakeholders from across the Nexus. It was an opportunity for stakeholders to discuss, to share ideas, to identify areas of alignment and opportunities. It was interesting when most of the stakeholders realized that the barriers to implementing self-care interventions are similar across the Nexus, while acknowledging that, of course, tailored solutions are needed to address these barriers. And that's a picture from one of the exchange workshops that we co-hosted. And so the collaboration across the Nexus kind of presented an opportunity for us to leverage existing evidence, resources, and lessons learned from implementation of self-care interventions in stable settings, which can be easily adapted in fragile settings rather than reinventing the wheel. Next slide, please. Thank you. And so as interest and investment in SRH self-care increases, for us, we recognize the importance of ensuring and enabling environments for sustainable systems change. So for example, in Nigeria, national policies and guidelines are disseminated through a process of domestication, in which individual states would kind of introduce the policy to the state and the local government authorities through a series of review, workshops, and then they would eventually adopt the guideline. So the image you see is from one of such workshops in Borno State, which was co-hosted by partners from across the Nexus, where we visited the Commissioner of Health in Borno State to introduce the guideline and to advocate for Borno State to begin the process of domesticating the guideline. Next slide, please. Yeah. Thank you. So following the orientation and dissemination of the national guideline in Borno State, which I said was co-hosted by partners from across the Nexus, the Borno State Self-Care Advocacy Network, which we call BSAN, was inaugurated. BSAN currently has about 50 members and we're still growing. So we welcome you to join the network. Membership cuts across the national and state governments. We have members from humanitarian and development partners. We have CSO organizations. We have regulatory agencies, faith-based organizations, and the media, all coming together to push for a common agenda towards advancing self-care in humanitarian and fragile settings. And finally, we believe that SRHR self-care can improve resilience to health shock. Next slide, please. Thank you. And so for us, we believe that SRHR self-care can improve resilience to health shocks. It can extend health coverage and improve health equity for all. However, more investments are needed to identify the best way to introduce, to adapt, and scale self-care solutions in humanitarian and fragile settings as we continue to glean insights from development settings and collaborate with stable settings. Thank you.
Great. Thank you so much, Omolara. You were perfectly on time as well, which we very, very much appreciate. So we have built time into this agenda. We have about 7 minutes or so for questions for our first 3 presenters. I have been scanning the chat box. I haven't seen any questions come through, but let me just pause for a moment. This is an opportunity if you want to come off mute and ask your question verbally, you can raise your hand and then I'll call on you. So I'll just give it a moment for you to either put a question in the chat box or to raise your hand and to come off mute and ask your question. is a quiet group this morning. Maybe what I'll do is I'll kick it off with a question, and then as others come to your mind, feel free to put them in the chat box, and we will ask them of our presenters. So I have a question for Pamela, our first speaker. So I understand that Kenya's National Self-Care Guideline came together with quite some speed. It might have even been maybe 8 or 9 months from when it was an idea that was being discussed to when the guideline was actually drafted and finalized. And I was wondering if you could say a bit more about how that guideline, adaptation, development process went so quickly, and what role advocates and civil society played in helping accelerate that process.
Well, thank you, Kim. Yeah, for Kenya, it was really, it really took off. It went really fast. And that is because even when we were looking to institutionalize self-care in terms of reproductive health, we realized that even post-COVID, already the ministry was looking at innovations that could promote self-care. There was a lot of adoption of telemedicine by different partners. And also at that time, as we advocated for self-care, it was such a coincidence that the ministry was also thinking of the same thing. So they had started developing a family planning self-care guideline. But now when we brought in the aspect of having a comprehensive guideline for reproductive health in terms of self-care, it's now probably just took family planning to a halt, first of all, so that we develop a comprehensive package for reproductive health. And we managed to do that. And then now, after we developed the guideline, we came back to look at what they had developed earlier, the family planning guidelines, and now incorporated it into the comprehensive reproductive health self-care guidelines. So what really helped us is that we were basically on the same wavelength with the Ministry of Health. It was very easy for us to get a buy-in from them because they were already thinking along the same lines. They just needed a bit of support, technical support and financial support in terms of developing the guidelines, which us as partners came to support in and help them contextualize the guidelines into our context and adopt them. So it was really, I would say it was really timely because at that point, the Ministry of Health was also thinking the same.
Great. Thanks so much for that response. And it's a good reminder too, just about the role of COVID and in terms of really shining a spotlight on the need to double down on self-care approaches. Oh, wonderful. We have a hand up from a colleague, Ibrahim. Please feel free to unmute yourself and ask your question.
Okay, thank you so much to all our presenters for the wonderful presentation. I have 2 questions. One for the second speaker, the second for Omolara. The first question is, a lot of discussion around self-care is how do you measure quality? Oftentimes when discussions around self-care come up, people are majorly concerned around quality assurance, especially in low literacy context. So I wanted to check with the consultant, how have they navigated that in Uganda as far as the discussion for self-care is concerned? Then for Omolara, there is this beautiful work that you're doing in Northeast Nigeria. How do you plan to scale it up, and the vision for your country program in FY24?
Excellent questions. So Moses and Omolara, just 1 minute each to respond. Thanks. So Dr. Moses, if you could go first. Yeah.
Thank you so much, Brian, for the good question. Now, in Uganda, what we did is that before we did the implementation at we what we call the technical working groups within the self-care expert group, the of care technical working group. And that group, what it did was to make sure that we standardize. We look at the global guidance on quality of care for self-care. There's digital quality of care for self-care. There are other materials at global level. So we incorporate them into Uganda self-care. But also the Uganda guidelines, we have also the quality of care guidelines for Uganda in the area of maternal, newborn, and child health. So we incorporated all that and we took them into the guideline and to the district. Now, while implementing within the district, we started now changing and adapting, making sure that health workers are adapting and also the self-carers. So our experience in ensuring quality was can I say work in progress? Because quality of care has many aspects, a bit of the commodities, a bit of trained person to give you the support to transfer the self-awareness. And that was just work in progress. Thank you.
Yes.
Go
Okay. Okay, so thank you so much, Ibrahim, for your question on what the vision for scale up of self-care is for us as IRC, what our priorities are. You know, Borno State is has the highest number of internally displaced persons in Nigeria right now, and it is the most impacted by conflict and crisis. And so currently with the BISAN network in place, we have developed a self-care advocacy strategy, and we're also working to develop a rollout plan, which we hope to test and model in Borno State. If we're successful in Borno State, it means implementation, replicating the solutions in other Northeast or Northwest states that have also been affected by conflict and crisis would be a very easy lift for us. And so that's how we're approaching it, starting from Borno State as the pilot state. Thank you.
Thank you so much. Very, very helpful. Great questions. And Fanya, I just put a message in the chat. If you could kindly put your question in the chat box, we'll see if we can get to that during the next Q&A segment. We're going to keep things moving along. We still have 3 more excellent presentations. We're going to continue our world tour, and we're going to head over to Senegal right now. So our next featured presenter is Ida Ndion. And she is a senior program officer at PATH, where she leads health programs, including self-care. She coordinates the Self-Care Pioneers Group and serves as a point of contact among the Ministry of Health, local partners, and the Self-Care Trailblazer Group. Prior to this role, she served as PATH's monitoring and evaluation coordinator for the introduction of subcutaneous DMPA in Senegal, including for self-injection. So Ida, the floor is yours. You have 8 minutes. Thanks.
Thank you. Thank you, Kim, for this welcoming. So I'm pleased today to share Senegal experience on mobilizing advocates for self-care across different health sectors. Next slide, please. So here I'm presenting how we have started our journey on self-care. Self-care is not new. For many of our countries, we already have experience on self-care. And for Senegal, we did experience the introduction on DMPA-SC, including in self-injection. So that was basically one of our objective to include our previous experience, learn from what we have done so far, and also learn from the other countries that have started the self-care journey before us. Here are some key missions that have been our journey. First, it was to build awareness and political commitment on self-care, to ensure the alignment among partners that is important, and I will share more about this partnership, this great partnership that we have in Senegal. And to build a self-care pioneers group, meaning that we have a little self-care trailblazer group in Senegal with partners and also under the Ministry of Health leadership. Our first focus was to build and to develop a self-care guideline. So next slide, please. Here is our pathway. We have started in 2019 when PAF has been selected as NSN, so the National Self-Care Network coordinator. The choice of PAS is really important here because PAS as the lead of DMPA-SC introduction in Senegal, have had this experience on conducting self-care program in Senegal with Ministry of Health. Additionally, PAS have a great connection with the Ministry of Health, and this has helped us to build commitment and leadership with the Ministry of Health. So some key achievement and strategy that we have achieved in Senegal. First, it was the symposium. And this have helped us to start the discussion on what would be self-care in Senegal. Regarding the partnership, we have the great opportunity to have WHO Afro leading this symposium and convening Ministry of Health and other health professionals in this symposium. And that's where we have started to discuss what might be self-care in Senegal. Prior to that, we have worked closely with Ministry of Health to build the leadership and present this project, not only a PAF project, but a country project. The idea was if we want self-care to be part of the self-care, the national health system, we need to involve Ministry of Health and build commitment and leadership on that question. And this happened during COVID-19, so that was an interesting experience to include self-care in the mitigation plans. We also have a great opportunity to consult different partners around this question of self-care. The question is here, what is the bottlenecks of self-care? How can we implement self-care? So building ownership and momentum around the different groups of partners and aligning on what we can build in self-care in Senegal was our different question to the audiences, meaning civil society, partners, decision makers. Then a key achievement was also to build a stakeholders mapping and also a policy landscape that help us to understand that self-care is not only related to health, and we have committed to include other ministries that I will develop later. And then with this pioneers group that have been launched in 2021, we have co-created national self-care guideline, and here now officially validated since 2022. Next slide, please.
Vida, you have 3 more minutes. Yeah, and I know you have a lot of slides. Just don't worry.
Okay. So some activity wins, but here I will highlight the leadership of the Ministry of Health, but also the multi-sectorial approach, because what we did in Senegal is to include at the beginning SRH, but also non-communicable diseases. We integrate maternal and child-borne health, we integrate HIV. So that's what we priority include in our self-care guideline, and this have built our advocacy strategy. You can move to the next slide, please. One of our important footprint, I can say, is the knowledge management and learnings. We believe that it's important to empower the group, but also learn from the other countries, and that's where we are really connected with Nigeria, where we have organized some peer assistance, and also completed some learnings experience between the other countries. Next slide, please. Advocacy and policy wins that we have also is an inclusive self-care guideline, but also integrating DMPASE self-injection in the mitigation plan. And one of our law that we valuably have contributed it in is the pharmacist law that have been revised to authorize family planning meta services in Senegal. Next slide, please. Some key learnings for the Self-Care Pioneers Group. This is really the foundation of our self-care adoption. We have worked previously on how to mobilize the stakeholders, the civil society, to build the commitment around self-care. And some learnings are that in the Self-Care Pioneers Group, PASS is acting as a facilitator. Leadership is Ministry of Health, but the partnership is around the Ministry of Health. And one example is that for our quarterly meeting, every organization can lead and experience a meeting with the partners. I think there is a last slide. Yeah, just here to show what is Self-Care Pioneers Group with civil society organization, Ministry of Family, NGOs, youth organization, Ministry of Education. And the last, but not the least, important thing, so key learnings and takeaways that we can share here on mobilizing advocacy is I say that priori the commitment around Ministry of Health, experience on DMPASE that we have valuably integrate in our strategy. Building consensus is important as well, and a strong pioneers group that support MOH in this self-care journey. So to finalize this presentation, I can just say that the participation approach is one key learnings that allow us to create ownership on self-care. So today we can say that every partner is a contributor on our self-care journey. Thank you.
Thank you, Ida. So sorry to rush you there at the end. But again, congratulations to you, the Pioneers Group. It's been amazing to see how you've been able to advance self-care, especially from a multi-sectoral lens. All right, we're going to move right along to our next presenter, Monica Mutesa, who's another colleague from PATH. She's the country coordinator on the Access Collaborative project in Zambia, which has successfully supported the introduction of subcutaneous DMPA in both the public and private sector, including the introduction of self-injection. Monica's deep technical understanding of health issues and connections to local communities in Zambia, as well as her in-depth knowledge of health sector dynamics and her practical program experience has shaped her into a strong advocate on health policy issues, one of the strongest I know. So Monica, over to you for your presentation. You have 8 minutes.
Thank you so much, Kim, for that kind introduction. I'll be speaking on the role of self-injection in paving the way for wider self-care guidelines in Zambia. Next slide, please. So the Access Collaborative provides data-driven technical assistance, coordination, resources, and tools to ensure that women and girls have increased access to DMPASC and self-injection as part of an expanded range of contraceptive methods delivered through informed choice. And the AC is led by PATH, and you can see the logos of our partners, Clinton Chai in Supply Health, Jopaigo, and JSI. So self-injection of DMPASC within the context of full and informed choice is a unique value add of the product and one way to expand self-care options for women and girls. In Zambia, the AC has supported the introduction of DMPASC provision and self-injection in both the public, which is in 8 provinces, and private pharmacies in 4 provinces. Next slide, please. So the self-care approach. We have had self-care advocacy, and we have what we call the Self-Injection Ambassador Initiative. And in this intervention, we have self-care advocacy plan. And we have 2 SI ambassadors. One of them is Dr. Mazimba, who has been very, very instrumental in making sure that the self-care agenda is fostered. He was part of the team that traveled to, I think it's Ouagadougou, to do the WHO self-care guidelines. So he has been very instrumental in making sure that we keep this on the agenda of the ministry and other partners. Then coordination, the AC has been part of the team that has helped to develop the self-care roadmap. We hosted the first self-care roadmap development meeting and the guidelines development meetings, which are led by other partners, but we are part of it. We have also been providing technical assistance, sharing materials and documents from other countries and providing technical assistance for guideline development. We also held a virtual meeting with our Nigeria counterparts. As you can see, Nigeria is a lot ahead. And so we held a LAN to understand their process of developing and implementing guidelines, as well as from Uganda, we have also learned that. Next slide, please. And so in terms of SRH self-care status and the way forward in Zambia, in February 2023, the AC convened a stakeholders meeting to address the following topics. We were asking ourselves, where are we as a country in terms of self-awareness, self-testing, self-management? We sat down to analyze opportunities and barriers for self-care, which included looking at policy, financing, legal, administrative, and delivery. And we looked at the way forward. So we agreed to establish a community of practice around self-care interventions. We agreed to support government to adapt and develop and implement SRH self-care guidelines and strategy, and also in raising awareness about self-care in various platforms. Next slide. So in terms of the actual roadmap, we initially identified stakeholders, we had timelines. We agreed that the ministry would inform and engage other units at the ministry. This was key because self-care is not just about reproductive health or family planning, it incorporates other areas. And then we had consultations with other countries, like I mentioned. And here we looked at cost drivers, process, concept notes, how they had got to where they have, and it was really, really informative. And then we conducted stakeholder orientations, including the relevant technical working groups, and PATH, the ministry, and WHO were assigned to do this by 31st March of this year. And then in terms of mobilizing resources for this, we had various partners, those that are stated there. We also conducted the situation analysis and documented existing self-care interventions in Zambia. And Jopaigo, PATH, and WHO were tasked to do this, and fortunately we did achieve. And then we're in the process of developing a costed plan for adoption of the WHO generic guidelines, including dissemination. And so there's a task team that has been formed together with the ministry. And the goal is that by February 2024, we'll have national guidelines on self-care that have been actually approved and launched. Next slide, please. So in terms of the lessons learned from this process, we learned that a well-implemented self-injection rollout can form the bedrock of self-care guidelines development and implementation, and can be used as a strong reference point for self-care. And this was evident in the way we kept on referring to how we rolled out self-injection in the community, in the public sector, in the private sector, how women are handling it. And this was used as a great reference point for beginning to develop our self-care guidelines. And then Zambia opted for a comprehensive in-community approach. And speaking to that, we realize that context will determine what is best. Allow a homegrown solution as to which MOH department will take the lead. Initially, family planning was in the lead, but later community departments took over. And the argument was that this self-care happens within the communities, and therefore the community department should have a complete overview of what interventions in terms of self-care are happening at the community level. And so we had that decision made. Things were moved from the family planning and reproductive health department to the community department. And right now they are taking the lead, and we are giving input with regard to our various sectors. Then the COVID pandemic highlighted the importance of self-care, and particularly self-injection in RH. I cannot overemphasize this, because this resulted in the ministry demanding guidelines to address self-care in such situations, but also in normal situations. Next slide, please. Thank you very much. And if you have any questions, there's that link. You're free to go there and get more information. But thank you so much for listening.
Thank you. Thank you so much, Monica. And again, you were right on time, which we so appreciate. And your presentation, I think, also really nicely sets up our final presentation of the day, just in terms of how we can leverage on self-injection, both to introduce and scale up that particular intervention, but also to piggyback larger self-care efforts. So our final speaker of the day, I'm pleased to welcome Dr. Sushanta Banerjee, who is the Chief Technical Officer of the IPASS Development Foundation, a partner organization of IPASS. Dr. Banerjee leads the research and evaluation team, providing technical guidance and overseeing the implementation of monitoring and evaluation efforts. His extensive research and evaluation spans diverse areas such as population aging, family planning, post-abortion contraception, private sector accreditation, sexual and reproductive health and rights, and abortion. All right, over to you to close us out today.
Thank you very much, Kim, for excellent, overstated introduction. And good evening, good afternoon, and good morning from India. I'm supported by an excellent team for this work: Samina Parveen, Pooja Sikund, Garima Matthews, and Anisha Agarwal. And the landmark and platform is set for the self-administration of injectables from the previous presentation. Next slide, please. See that, in India, that introduction of Jhimpa IM in the private sector is, happened almost 16 years back in the early 90s. But unfortunately, it took a great amount of time to introduce in the public health system in the national basket of family planning, which is introduced in 2016 and 17 in the name of Antara. That was a path-breaking, movement that DIMPA IM was introduced. There are, some evidences on DIMPA IM from the India, and which highlighted factors and its, resilience for the uptake and acceptance, and clarified general perception surrounding injectable contraceptives. In a country like India, which is having huge diversity, those were very, very prominent. But there is no understanding or evidence in India on the subcutaneous DIMPA, which may influence the adoption and administration. There was almost nothing. This study and this work, policy work, provides recommendations for scaling up DIMPA SC, which is actually just introduced in India from the product concept. That we got product and it is launched in the public health system just 4 months back. Therefore, our age of working with DIMPA SC is just 4 months. But with that, our approach of going ahead and scaling up for this self-care is already on in the country. Thank you. Next slide. And see that, we have adopted a method of triangulation to understand and create a landscape for policy advocacy for the next generation, that how we can use it for self-care. First, we tried to drawing upon global literature on, DIMPA SC, and evidence and research studies and policy documentation from low and middle income settings, so that we can context the setup for the country, which is comparable. And some of the presentations we have seen, these countries actually has created the landscape for India's global review. And then when global review is done and we got some understanding, we launched a huge pan-India study with a sample of 3 broad stakeholders: women, and providers and pharmacists, who actually can push the approach of self-administration of DIMPA SC. And this research has given some thoughts and landscape for the future. And then also we analyze that good practices, which is stated from the WHO self-care guideline. Triangulation of this thing is actually called experts from different floors of family planning in India, including donor, implementing agencies, and policy advocates to discuss the future, how we can really scale up DIMPA SC for the self-administration. That was a fabulous movement, happened April 2023, recently. Next slide, please. Now, from the global review, we got some interesting learning that, research from Kenya has given an approach of reaching to the last mile. Kenya and Congo study spoke about the expanded provider base through evidence-based research. A study on Nigeria, spoke about the targeting the high volume contraceptive service providers and leveraging their existing whole-scale distribution channels. Uganda study, that formal medical wastage disposal mechanism, and Senegal, Nigeria, and Uganda strengthening system for better stock management, and another interesting domain which actually really worked in India is that schedule management, supportive tool, and take-home units, and tailored client support mechanism that ensure compliance. This global evidence has actually strengthened our approach to do the research. The next level, if you see next slide, that this study is very interesting because it's a large sample and from spread across 19 states in India. Therefore, I'm presenting this in one slide. Challenging job, but it is very interesting, given the time constraint, that we tried to examine the concept of DIMPA subcutaneous and from this domain and lens of self-administration, reasons why people are liking it, support required, and the concerns and challenges perceived, willingness to pay, and preferred influencers and sources for different stakeholders who can change the world, who will be the real catalyst and preferred sources of procurement. And when we ask these women healthcare providers and pharmacists, probably we thought, because government took 16 years to launch in the public health system from the private health system because of strong opposition. I think, we thought there will be some negatives, but interestingly, from all stakeholders, broad statement, we didn't get any negative reactions. Interestingly, 55% women feel we are comfortable to try self-administration. And this percentage is huge, given the country's population. Providers, they are willing to provide services and they like the environment and product. And the concept actually is tested given the concept, because the product was not available at the time of the research. They like the concept. Pharmacists, they raised some concern about prescription and non-prescription, but they also didn't raise any negatives that they cannot really push the approach of self-administration. Therefore, when we actually check the willingness to pay, that also have given an interesting mileage that women are actually, they want to give $3 to $4, which is actually the price of, Dimpa, I am here for the self-administration package. I think that is the interesting learning from this research. We will be able to share the research document to you, which is in design stage now, and then that will give a clear idea of different domain in this research. Next, please. In the triangulation, when we did the expert group meeting to get the policy recommendation, we got some interesting suggestion from the experts of family planning for the self-administration. First thing we got, that adopting a total market approach to get the maximum impact. Now, for other self-care, here nobody said that you do in one narrow component of the market. Everybody said, please do it everywhere so that women get access and we actually get the benefit of self-care. And I think the last speaker actually spoke about the COVID pandemic issue, and that is actually helped us to influence that dialogue. Establishing health system linkage in method initiation and continued adoption. Therefore, some linkage is required at the beginning, and that should be dynamic. With need, it needs to be changed to act as a support mechanism and responsibility of self-administration between the client and the health system, as a continuum which can shift over time depending on the needs of women. Implementing, task sharing and specialized training. Many has talked about the specialized training at different levels for self-administration. It is not the provider, it is the pharmacist, it is the community health workers, which is popularly known in India, ASHA, and also the caregivers of women, and finally the women. Therefore, a 360-degree approach of passing training from one corner to other corner for the self-care. Monitoring of uptake also has been raised as a strong recommendation, because that we have a strong health information management system under the national policy. But that exclusively counts the uptake and coverage of government, and private sector is having limited scope to enter into that arena. Therefore, here the support is that we need to motivate private sector so that this data of public and private sector comes together to talk each other what is happening and how we can learn from each other. And finally, generating demand and building motivation, which is actually other countries already has mentioned. As a next slide, I will say that we are in a situation where just our age of experimenting Dimpa SC is just 4 months. But within this 4 months, we have started creating a strong advocacy network for planning the self-administration in near future. And we are having very positive echoes, which is giving a good vibe for us. Dimpa introduced recently, launched as a pilot in selected states of India. Government of India has not introduced in all states, in selected states, and actually piloting and observing the result very clearly. Along with our expert group meeting, there is another meeting, conveyed for understanding the WHO self-care model and self-care guideline, not only for injectables, but for all domains, and which gathered government and non-government and private sector together to talk on the self-administration. That is, the flag is on, and we will be learning from you because we are now at the beginning. Thank you very much.
And thank you, Dr. Banerjee. I couldn't have said that better myself. What a wonderful presentation, and so exciting to hear the progress being made on DMPA, SC, and self-injection in India. And we're excited to see what's to come. So we have about 5 minutes. We only have 5 minutes. We do need to end this meeting promptly at 12:30 for questions for our last 3 presenters. I'm going to pull one from the chat box that was put in a bit earlier. The question is, I'm going to direct this to Monica because I think you have some practical experience that you can pull on from DMPA SC. The question is, considering most of the self-care experiences shared is from resource-poor settings, how are we ensuring environmental protection and safety and infection prevention, especially from waste generated through self-care implementation and advocacy? Monica, perhaps you can say a bit about some of the waste disposal that you've encountered with DMPA SC in Zambia. Thanks.
Sure. Thank you very much. That's a great question. For DMPA SC, SI, and the waste management, I'll speak to the case of Zambia. What we have done is when women or providers, particularly in the community, because community health workers or community-based distributors are allowed to provide DMPA SC in the community. They are one of the points where women in the community can go and deposit used vials for them to then pick up and take to the facility and have them incinerated at the facility. The other way is we have made sure that women are confident in understanding that they can use a non-penetrable container, one that can be, like a used bottle or a used container. So once they collect that, they can either take it to the facility or they can take it to a community-based distributor to then pass on. And that has happened both in the public and the private sector. And the community health workers are given containers that they use to collect that and take it to the facility. So in that sense, we have not had as challenges from that perspective in terms of how that system is working. I don't know how it is working out in other countries, but I think given the kind of trainings we do, the kind of follow-up, supervision, and monitoring, we try and ensure that we have that going on properly. We even have a task force on the Family Planning Technical Working Group that makes sure that that is actually happening. Of course, there are some instances where you may, see women maybe taking long to take things to vials to the facilities, but I think so far it has worked well and we've not come across that kind of challenge. Thank you.
Very helpful. Thank you so much, Monica, for that. I don't see any other questions in the chat, but Bonnie, I do wonder if you'd be willing to come off mute quickly and just let people know what the advocacy pack for DMPA SC is. Many of us are advocates on the call and might benefit from knowing about and using that tool.
Yes, absolutely. Thanks, Kim, and thanks for the opportunity to plug the advocacy pack. So yes, as many of you know, PATH developed this advocacy pack back in 2017, and it contains a variety of resources and tools for both advocates and decision makers to enable strategic advocacy on the introduction, scale up, and institutionalization of DMPA SC and self-injection. And it was last updated in 2019, and we are finalizing an update for 2023 and anticipate that this will be updated on the website in December, and we'll be doing a big push around it in January of next year. And I will drop the link in the chat box for everybody, so you will have that. And yes, if you've got recent evidence that I could include links to in the advocacy pack, please don't hesitate to reach out to me with that. I've got my email in the chat as well. Thanks so much.
Thank you, Bonnie. You know, I think I wish we had more time. I feel like we just scratched the surface here and we could have an excellent conversation for hours, but unfortunately our time together is going to have to come to an end. My colleague Diana just put a brief survey link in the chat box. We really appreciate if you could spend a couple minutes and help us evaluate today's session. But just before we close, I just want to reflect on just a couple things that stood out to me. I put this in the chat earlier, but it's really striking how we've already been doing so much learning and sharing with each other, which is so excellent. I think no one wants to reinvent the wheel. So much great evidence and good practice has already been generated in a variety of countries. And what was really heartening for me to see too was the concluding presentation by Dr. Banerjee, because you're even looking to countries in Africa who have sort of been leading the charge, and it's great to see India pulling in lessons from the African continent. And then I also just want to put out that plug for us to be thinking about that humanitarian development nexus as well. I was so happy that we had a presentation highlighting this exciting work moving forward in Nigeria specifically, you know, with crises increasingly affecting us all. As self-care advocates, we need to be thinking about being deliberate about bridging that divide. So with that, I just want to say thank you. Thank you to our presenters. Thank you to all of our participants. Thank you to our interpreters who have been working very hard behind the scenes to make this accessible. And we still have 14 more self-care learning and discovery sessions to go. You know, please go to the conference webpage and register for the remaining sessions that you're interested in attending. We would love to keep seeing you and interacting with you over the next several weeks here. Thank you so much. Really enjoyed this discussion. It's put a spring in my step for the rest of the day. With that, we will adjourn this meeting right on time. Wishing you all a wonderful day and all the best as you continue to advance self-care in your countries and in your contexts. So thank you so much. We'll end this meeting now. Take care, everyone.